ask Mike Doyle and Ron and Frank Peters and Ron, anybody else you want to have come up to the stage for this next award. Tonight, we are dedicating a new award in honor of Lilia Peters, who was a devoted healthcare consumers volunteer, supporter, and board member, and who made our community better. Lilia Peters passed away last December at the age of 79. She and Ron had been married for over 51 years, and they were incredible partners in raising their family and in serving the communities to which they belonged. Anyone who is fortunate enough to know Lilia knows that she was a true and loving friend, and she changed people's lives for the better. She was a small lady, but she was very mighty. It is our great privilege to be able to dedicate an award tonight in her name to help honor her lasting impact on our community on an ongoing basis, and to recognize the work of other community members who exemplify Lilia's legacy of caring for others. Mike Doyle will present the dedication of the Lilia E. Peters Service to New Immigrants and International Community Award. Lilia was little, she gets an award with a big name, like her heart was. I will introduce Mike now, but I will keep it short because Mike really doesn't like being in the spotlight. Mike is the founder and former executive. I don't even need to look. Mike is the founder and former executive director of our organization, which he started 41 years ago in 1977 because that's the part he hates. I appreciate it. Because he saw a need in our community for an organization that would give voice to us, the consumers and patients, and that would prioritize the needs of people. Mike, along with his wife, Loretta Morales, and the work of healthcare consumers, attracted many amazing people to the organization, and their work changed the course of healthcare in our community for the better. Just to name a few examples, we have midwife services in Champaign County and prenatal care programs for low-income women, the Medicare 100 Plus program, and school breakfast programs in the county, among other many services that we now take for granted because of Mike Doyle and the people who came to work as volunteers, staff, or board members with healthcare consumers. Believe it or not, establishing every single one of these services and programs was a struggle that had to be fought for and won. Mike currently works as the executive director of the University YMCA, which has been in the forefront of creating programs and organizations to serve the needs of immigrants in our community, including Immigration Forum and the New American Welcome Center, among others. When I joined the organization, the board of directors that I got to work with included Mike Doyle and Lilia Peters. Even once they left the board of directors, both Mike and Lilia have remained part of the healthcare consumers family and have contributed to serve the community in very important ways, for which I'm deeply grateful. Now, I will ask Mike to present the dedication of the Lilia Peters Award.
Thank you, Claudia. And I'm going to go rogue for a second. You know, it's always a wonderful thing to come here. Anyway, if anyone knows me, they know I like raising money for good causes. And I can't think of a better cause than this organization. So as I was sitting there tonight, I leaned over to my wife and said, can we afford to give $250 to the Champaign County healthcare consumers? And then I asked Barb Pritchard next to me if she would match it, and she agreed to do it. So my challenge to all of you is if we could raise $500 for each table in here, that would be $10,000 to the Champaign County healthcare consumers. So the challenge is to you. Not all the tables can do it, but some of us at some tables can do more than others. And so I really would like to ask everyone to grab that little green piece of paper and to take a moment and to fill out something that you can give that's a little more than you might have thought you could give. We're so fortunate in this community to have a group like Healthcare Consumers and to have people like Claudia and the staff here who have carried on this work far beyond any of us who were there at the beginning. So please consider doing that and join with Barb and I and see if we can raise $10,000 for the healthcare consumers. No one likes to do fundraising except me. Many of you have gotten emails about our dinner coming next week, so you'll hear one more time. To get back to the agenda. It is my privilege tonight to be able to help dedicate the Lilia E. Peters Service to New Immigrants and International Community Award in memory of and in tribute to our friend and sister Lilia Peters. This award will honor Lilia's life and work by recognizing others in our community who work to improve the lives of immigrants, as Lilia did. Lilia did this work with extraordinary energy and compassion in delivering healthcare services to newly arrived immigrants and arranging access to healthcare providers in our community. Lilia herself was an immigrant from the Philippines. She came here to pursue a career in nursing with the exchange nursing program. Her career choice already tells you that she was a caring person. Starting in the 1970s, Lilia worked with Burnham City Hospital and McKinley Student Health Center. She also completed her master's degree in health education at the University of Illinois. And after retiring from McKinley in 1994, she joined the CU Public Health District as the County Tuberculosis Coordinator, who worked tirelessly in monitoring and supporting TB patients. Lilia had a special affinity to and compassion for immigrants in our community. She understood exactly how confusing and daunting it could be to be a newcomer here and to need health care. In recent years, Lilia worked with newly arrived immigrants, international students, student dependents, and elderly immigrants with special needs. She was particularly effective in getting expectant mothers lined up with prenatal care through the Kids and Moms program. She got school-age children lined up for school physicals and immunizations. She worked with international student dependents in thwarting TB and in other infectious diseases, and with elderly immigrants with special health needs. You know, I don't actually remember when Lilia first became involved in healthcare consumers, but it was in the early days of the organization, and she remained an active volunteer for the rest of her life. I do remember Lilia doing advocacy for the patients she cared for, along with a number of other great nurses in our community, such as Fran Friedman and Jan Anderson. Lilia was deeply committed to improving the lives of her patients and to community members who needed health care, whether through public health clinics or hospital services. In fact, Lilia was part of the team of nurses who in the late 1990s helped us advocate and organize for the creation of a countywide public health department. Lilia was not the kind of leader who would give a speech at a rally. I relate to that. She was not the kind of leader she was the kind of leader who was stalwart, reliable, and true. She showed up for every meeting, she contributed her voice, and she did the work. And she brought other people into the struggle through her encouragement and support. With her quiet, steady, and caring ways, she helped build our community. She had grace, compassion, and humor, and she was universally loved and appreciated. Lilia had an important voice, and through healthcare consumers, she helped give voice to others in order to make improvements in our healthcare system. Champaign County healthcare consumers exist to give people voice, to give voice to people. And Lilia was one of those people. Lilia made sure that the priorities of people she cared for would not be ignored, and that those priorities would be part of shaping our healthcare system. Organizations like healthcare consumers play an important role in our community, but organizations are made up of people who bring their gifts, their strengths, their priorities, and their voices to the organization. With a grassroots organization like Healthcare Consumers, the whole is often greater than the sum of its parts. But when I think of Lilia Peters, I'm reminded that these parts, these individuals, are at the core of the organization. Lilia's work, most of it which she did on a volunteer basis as a helper and a connector in our community, impacted many people's lives, and she left a lasting legacy. And by dedicating this award tonight in memory of Lilia and her work, we will continue to honor her lasting legacy and recognize those important people in our community who do the hard work of serving immigrants in the international community here in Champaign County. Ron and Frank, on behalf of the Champaign County Healthcare Consumers, it's with great admiration, gratitude, and love that we dedicate the Lilia E. Peters Service to New Immigrants and International Community Award to Lilia.
Family, that we're very, very pleased that you went about to give this award. And it also shows that Champaign County Healthcare Consumers is expanding its growing family to the international community, and particularly to newly arrived immigrants, of which this community has many, many. And I think notice we're sort of at the end of the program, but Lilia would see the irony in being just ahead of Rodney Davis. Okay.